Dade. One local woman says she was told by her doctors she likely has the virus, but has not been able to get the testing done to confirm it.
She spoke with CBS 4 investigator Jim dept about what she experienced when she sought treatment. It's a CBS 4 News exclusive.
Walking into the Jackson Memorial ER Friday afternoon, Marie had one question on her mind. Did she have the coronavirus?
I started feeling a little bit sick leaving Italy on Wednesday morning. I was having a rather severe sore throat and a headache and mild cough, and the cough progressed over the next couple of days.
She had spent a week in northern Italy, just as the virus was spreading across that region.
There was definitely a sense of doom and dread everywhere.
Afraid of being trapped in Italy and anxious to return home, she boarded a flight to Madrid and then on to Miami, where she landed at MIA around 9 o'clock Wednesday evening.
There were no screenings at Madrid, and there was no screening when I arrived in Miami.
She stayed home from work on Thursday, but by Friday, her husband and personal physician told her she should go to Jackson to see if she had the coronavirus.
And they immediately admitted me. Very quickly, I was placed in a room, and they started diagnostic testing. Everybody who was coming into the room was very well protected with goggles and all the necessary, protective gear. My preliminary tests came back rather alarming because I tested positively for 2 strains of the previous coronavirus.
The current version of the coronavirus is known as COVID-19. Marie, whose name we've changed to protect her privacy, provided the results of her medical test performed at Jackson, showing she tested positive for earlier strains, coronavirus 229E and NL63.
The doctor himself told me that, he thinks that the results of my test mean that I most likely have the COVID-19. But that the Department of Health did not want to pursue it further. It was either the Department of Health or the CDC that decided not to further pursue the inquiry. But I was basically told it is most likely that I have this virus and that I should self-quarantine.
And when you hear that, how do you react to that?
Obviously, I would have liked to know if I, in fact, have this virus.
She said her doctor at Jackson was angry and annoyed he couldn't get her samples tested.
The doctor said that there was basically nothing he could do.
Instead, she was sent home and told to stay in her house for 14 days.
I was given masks. I was asked to self-quarantine, and that was pretty much it.
Dr. Eileen Marty is a world-renowned infectious disease specialist teaching at FIU. She did not see Marie as a patient, but given Marie's travel to Italy, her symptoms, and the test results she reviewed, she agrees with Jackson's diagnosis.
She probably does have COVID-19. The fact that we're not testing unless somebody is severe or critical is basically a problem because we're missing 80% of cases.
If we're not doing the testing, then we really can't say the extent to which COVID-19, the coronavirus, is here in our community, can we?
No, if we don't test, we absolutely, you can't tell.
Marty said she understood the frustration of Jackson officials.
I also would have been angry and annoyed, in fact, even furious, because it doesn't allow me to treat my patient in the ideal way. And one of the things that every patient wants to know is, what is wrong with me?
I think it's naive to think that we are not going to see any cases here, that we have this contained. I mean, there are hundreds of people pouring in every day from all over the world. We need to have the proper testing measures available.
Marie says her husband is now sick.
But we're both doing okay. He's staying home with me, so we've stocked up on supplies. so I'm not so worried. We're both monitoring symptoms, and we're doing okay.
Wow. Hard to believe. It sounds like the doctors at Jackson wanted to do the right thing. They simply couldn't. The reason is, why not?
Well, the question, that is, I think you're absolutely right. If we accept what Marie says with regard to her doctors, then there is clearly some sort of miscommunication between the doctors and the protocol that Jackson believes it's under, and the Centers for Disease Control in Atlanta and the State Department of Health. Now, I spoke to Jackson, and they wouldn't comment on this woman's case specifically, citing privacy concerns, but they did say they follow the procedures and rules as set out by the Florida Department of Health and the CDC. I talked today to a senior official within the DeSantis administration, the Deputy Secretary for the Department of Health in the state of Florida. Again, she didn't want to get into specifics with this woman's case, but she said that no, based on the general idea that this woman came from Italy, was presenting signs, there was no reason why the State Department of Health shouldn't have done testing. And they said going forward, if you believe that you're liable for the coronavirus, you don't necessarily have to go to the hospital. Contact the County Department of Health, the State Department of Health, and they will arrange for a place for you to go to be tested, because that's the problem right now. We're not testing. You know, this notion that there is no coronavirus in South Florida, I think is largely a myth. Until we start doing more widespread testing, we won't know the extent of the problem here.
If you're not testing, you're not going to find out.
Nope.
Jim, thanks a lot.